As some school districts in our state are getting ready to welcome back students next week, a new report shows an alarming increase in COVID-19 cases among children. WWAY's Matt Bennett joins us now with more. Matt, how high are the numbers?
Hannah, this new data shows a 90% increase in COVID-19 cases among children across the U.S. over the past month. One local pediatrician says children can experience different effects than adults, which in some cases could be life-threatening.
The tricky thing is that kids and adults can pass COVID very easily without having symptoms.
Dr. David Hill sits on the North Carolina Pediatric Society Planning Committee. Although he lives in Wilmington, right now he is primarily working in Wayne County.
We're a very small hospital, and I have already admitted myself a handful of children for COVID. I've also had babies born to COVID-positive mothers.
He says unlike adults, COVID-19 symptoms in children more resemble that of food poisoning.
Adults usually have a cough, they can't smell, they may have difficulty breathing. Children are more likely to come in with nausea, vomiting, diarrhea, belly pain, fever.
Dr. Hill says the other thing unique to children is MISC, or Multisystem Inflammatory Syndrome.
That is actually sort of an immune response that can occur 2 or 3 weeks after the initial infection, but it can be life-threatening as well. And in North Carolina, we have already had at least 10 confirmed cases of MISC in children, including one that I've seen.
A new report by the American Academy of Pediatrics and the Children's Hospital Association shows a 90% increase in COVID-19 cases among children across the U.S. over the past month. Dr. Hill says while the virus may affect children differently, that doesn't mean it isn't dangerous.
On average, children are less likely to get serious disease from COVID. Children, however, can and do get hospitalized, and of children who get hospitalized, 1/3 end up going to the intensive care unit.
Dr. Hill says if schools and the larger community are diligent about mask wearing, hand washing, and social distancing, he believes both students and teachers will be safe this school year. Randy?
Thank you very much, Matt.